Hello everyone, this is Dr. Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss the most unspoken conversation of pregnancy, that is sex during pregnancy. Most of the couple have lots of questions in their mind, but they are still hesitant to even discuss this with their gynecologist. This makes the sex during pregnancy the biggest taboo of pregnancy. Many wanted to have a conversation, but something stops them from having an open conversation. Because of which there are lots of myths surrounding the sex in pregnancy. Let's debunk it one by one and also discuss in detail about sex during pregnancy. What are all the do's and don'ts? What are all the red flag signs after sex in pregnancy? Let's get started. We have heard lots and lots of myths around sex during pregnancy. The most common ones are it will harm the baby. No, it will not harm your baby because your baby is not just beneath your skin. The baby is surrounded by a cushion of amniotic fluid. On top of it, the baby has a thick musculature of the uterus. Above that, there are multiple layers of abdomen and there is a thick mucus plug at the mouth of the uterus. So there is no way that the penetration is going to go into the uterus or it is going to harm the baby directly. So it's an absolute myth. Will it cause or impose bad thoughts in baby's mind? No, absolutely it won't. When the woman is involved in the sexual activity, she releases few hormones which will de-stress her. When the mother is relieved and when the mother is less stressful, this will have a positive impact in the baby. But it will never impose bad thoughts or bad intentions into baby's mind. Number 3, will it lead to labor? Actually, no. The penetration is going to be at the level of the vaginal canal only. This is not going to surpass the cervix. But sometimes the hormones which is present in the semen can resemble close to that of the prostaglandins present in the cervix, because of which it can initiate contractions. These contractions usually fade off in some time, but during the late stage, it is generally advisable not to have sexual activity to avoid taking a chance. But for the same reason, in the term pregnancy nearing your EDD or in post-dated pregnancy, the couple will be advised to have a sexual intercourse such that it can initiate contractions which can help in labor. But there are not much scientific evidence to support the same. When should the couple not involve in sex during the pregnancy? When the woman has any previous history of miscarriage or has any risk of miscarriage in this pregnancy, it is generally advised to avoid intercourse. Number 2, when there is a low-lying placenta, it is advised not to have intercourse. Number 3, if there is any spotting or bleeding per vagina or vaginal discharge because of any infections during pregnancy, the couple would be advised not to involve in sexual intercourse. Next, if the woman is conceived with multiple pregnancies, twins or triplets, then it is safe to avoid sex. Or if the cervix, which is the mouth of the uterus, is actually short or incompetent, which opens up during the course of pregnancy, it is advised to avoid sexual intercourse. Also, when a woman has cervical stitches in place, it is advised not to involve in active sexual intercourse. And the final one, if there is any risk of preterm or premature labor, the woman or the couple is advised to avoid sexual activity. What are the positions that they can adapt during the sexual intercourse? Any sexual position is fine except for the fact that it should not cause direct pressure over the woman's abdomen. This can make the women uncomfortable as well as can lead to some complications. What are the red flag signs after sex during pregnancy? Number 1, any kind of abdominal pain after sex. Number 2, spotting or bleeding per vagina. Number 3, any discomfort which doesn't usually settle in some time. Number 4, contractions which doesn't settle after few seconds. Number 5, any kind of watery discharge or leaking per vagina. These are the red flag signs that has to be addressed after sexual intercourse during the pregnancy. Anytime after sex, if you face any of these above problems, then you have to reach out to your gynecologist. What if the woman has no interest towards sex? It is absolutely normal. Few women feel increased sexual drive during the pregnancy while others feel low sexual interest during the pregnancy. Both are absolutely fine. In such cases, the women should have an open and a relaxed conversation with the partner to make him understand how she feels about her own self and what is the reason holding her from having sexual intercourse. And they can also discuss about other options to feel that intimacy in place. When is the ideal time to have sexual intercourse? It depends on the couple and especially on the women, as I mentioned earlier. But ideally, the first 3 months, the mother would face many problems such as vomiting, nausea, tiredness, fatigue, because of which she might not be interested in sexual relationship. in late stages of pregnancy, because of the pressure effects and discomfort, the women might not be up for a sexual relationship. So the ideal months for sexual relationship would be 4, 5, 6, because the women would have less fatigue, less nausea, less morning sickness, as well as not too much of discomfort with their growing belly. But again, it depends on the women. Her physical and mental condition towards the sexual intercourse decides the frequency and intimacy in their relationship. Should the couple use any form of contraception? Yes, if the woman is not sure about the sexual activity of the partner, it is ideal to use contraception to prevent against sexually transmitted infections. Pregnancy will never act as a barrier in transmission of sexually active infections. So beware of this fact and always use contraception, especially condoms, when you are in doubt. So let us break this taboo of having this conversation behind the doors and not having an open conversation with the healthcare provider. Many a times, having your mind cleared of so many things will give you great clarity. So have an open conversation with your doctor to get your doubts cleared. I hope you found this video useful. If you like this video, do like, comment and subscribe to my channel and press on that notification bell icon so that you receive regular updates on upcoming videos in my channel. Until I meet you in the next video, stay happy, stay mommified.